Hello everybody. Okay, before we get into the discussion about the new CDC report, I wanted to give you a quick overview of my game plan for releasing the health screening topics on the Your Health Academy website. So what I've done is I've gone through the United States Preventive Services Task Force. I've taken all of their screening recommendations and tried to explain those in a way that non-medical people could understand them and hopefully get some benefit from that. I've sort of loosely divided them into 5 categories, and those categories are cancer screenings, cardiovascular health and screening for that, infectious disease / sexual health, mental illness and substance abuse screenings, and then just miscellaneous screenings. So what I did is I started by writing articles about each one of those screening recommendations, and then the plan is to also go over that same content again with short videos, and then additionally more long-term videos in a discussion with a specialist in that field of medicine. That'll be kind of in the form of a video podcast. So that's the idea. I wasn't sure which of these categories to start with, but I've decided to begin with the mental health and substance abuse screening category, and I decided to do that after reading this report from earlier this month that came out from the CDC. This report really bothers me. I've always had some concerns about the stress caused by the pandemic and also from the mitigation efforts due to the pandemic. And I've been hearing, unfortunately, numerous anecdotal stories from law enforcement personnel that I know, mental health professionals, and public health officials that they have been seeing an uptick in mental illness, overdoses, and suicide. So let's get into the report. First of all, this is the same report that I discussed in the Your Health Academy newsletter that came out yesterday. The report is based on surveys conducted by the CDC on 5,412 adults, and it was assessing self-reported mental illness, substance abuse, and suicidality. And these individuals reported that over 40% were struggling with mental health or substance abuse issues, 31% had anxiety or depression, 26% had trauma or stress-related disorder that is specific to the stress caused by the pandemic. 13% reported an increased use of substances or that they initiated use of substances. And then probably the most concerning is that 11% of everybody surveyed has had thoughts of suicide within the last 30 days. Now let's take a look at this table from the CDC's report. I've highlighted this particular section because I find it both interesting and telling. What you're looking at here is that there's an inverse relationship by age group between individuals who are at the highest risk of serious complications or death from the virus and the mental health impact from the pandemic. So what that means is that if you're younger, like look at the 18 to 24-year-old group, younger individuals are reporting significantly higher levels of anxiety, depression, that COVID-19 related stress disorder, substance abuse, or suicidality than the group that's the highest risk for suffering serious complications from the virus. And this isn't just a concern for young adults either. Robert Redfield, who's the CDC's director, recently came out talking about the impact on high school students. These individuals weren't able to be surveyed due to being underage. But he recently said the following, quote, "There has been another cost that we've seen, particularly in high schools. We're seeing, sadly, far greater suicides now than we are deaths from COVID. We're seeing far greater deaths from drug overdose that are above excess that we had as background than we're seeing deaths from COVID." And when you think about it, you can understand why young adults and high school students are at risk here. First of all, they suffer from higher levels of suicidal ideation and risk-taking behavior to begin with. Second of all, there is a legitimate concern about the virus, and that leads to this overarching environment of fear that we're in right now. Third, we've taken them out of their structure. We've taken them out of their routine. In a sense, we've taken away their purpose by closing their schools and their places of employment. Basically, they've been destabilized. Fourth, adults aren't doing a great job of setting a good example right now. Kind of seems like all the adults hate each other. And then fifth, we've stripped away whatever joy they had left by not allowing them to spend time with their friends, by not allowing them to participate in their favorite activities. I want you to take a look at this photo of the Wichita Southeast football team. This is shortly after being told that their season had been canceled. Obviously, it's very devastating to them. When we used to live in Wichita, our apartment was about a block and a half from their practice field. I used to go jogging all around that area, and one of my best memories from living there is listening to how much fun those players had out there during practice. It's a shame now to think of that field being empty, with no laughing, no camaraderie, and no trash talking going on. Yeah, I'm not convinced we're helping anybody with all of the helping in this case. But it's a difficult time for everybody. There's a lot of tough decisions that need to be made. So, in the meantime, please just be aware of this. Keep an eye out for yourself and your mental health. If you can, please try to keep an eye out for others. Ask how they're doing and offer support if you can. Most importantly, if you or someone that you know is suffering from mental health issues, substance abuse, or especially thoughts of suicide, don't hesitate. Get a hold of your healthcare professional and get some help. Don't hesitate, just do it, okay? Please and thank you. Okay, I want to hear what you think about this report. What other factors do you think might be contributing to the findings here? Please comment below. I'd be interested to see what you think. Also, I am pleasantly surprised by the number of you who have signed up for the Your Health Academy newsletter. The first one came out yesterday. If you would like to subscribe but haven't yet, I will include a link below to do that. Now, the last thing is the next video is actually going to be all good news. I've decided that this report was far too depressing, and I think looking at some positive developments, and there have been some, looking at some positive things would be a nice change of pace. So that will be up soon. I will talk to you then.